Artis, Hair Restoration Redefined. Hello, my name's Mike with Restoration Robotics. In this short video, I'm going to take you through an Artis system case example, step by step, from start to finish.
Eric, this will be the last time I want you to have a seat in the chair here.
A case with the Artis system starts with getting the patient comfortably seated in the Artis system chair.
Okay, and there's some adjustments I can make to it. I can move this back and forth and also move this up and down. So we're going to try to find the most comfortable.
The Artis system chair was designed to position the patient's donor area in the optimal position for harvesting, and, more importantly, provide comfort for the patient throughout the case.
And I'm also going to tilt this up and down.
The patient's donor area will be shaved down to a length of 1 millimeter. After cropping the donor area, we'll go back for a second pass to assure a length of 1 millimeter. Next, the area will be wiped clean of all loose hair. After shaving, the patient's donor area will be anesthetized. The Artis skin tensioner, its storage tray, and the Artis skin tensioner tool are placed on a tray patient side. Now the physician can simply grasp the tensioner using the tensioner tool, compress it, and install it in the donor area. The Artis skin tensioner has specially designed straps that attach directly to the patient chair. These straps offer the patient a passive reminder not to lift their head up during the procedure, and they provide an added level of stability to the donor area. Before each grid, dilute epinephrine is injected for hemostasis. Now that the patient is comfortably seated, the donor area has been shaved, and the Artis skin tensioner has been installed, we're ready to move the robotic arm into position. This process begins by moving the robotic arm to the center position and selecting the relative location of the grid to be harvested. The process of moving the system over the patient's donor area is comprised of holding a button on the Artis pendant, grasping the needle mechanism handle, and moving the system to the desired position. With the system in position at the center of the skin tensioner, we'll now acquire it using the automatic tensioner reading feature. The Artis skin tensioner features fiducial markers on all four sides. These fiducial markers, when acquired, are used to track follicular units before and after harvesting. Acquiring the skin tensioner will automatically position the system in the lower left-hand corner of the grid. We're ready to begin harvesting. At the beginning of the first grid, we're going to use puncture-only mode. In puncture-only mode, the system only fires the sharp needle. This allows us to study the puncture depth independent of the full harvest cycle. After each harvest attempt, a still image is presented in the upper right-hand corner of the screen. This image indicates how deep the needle is entering the scalp. Now that the initial puncture depth setting has been determined, we'll switch to fast harvest mode. Fast harvest mode is the mode used for the majority of an ARTIS case. This mode consists of firing the sharp needle followed by the dull dissection punch. When prompts are turned off, this cycle repeats in rapid succession throughout the grid. In fast harvest mode, an additional image is displayed in the upper right-hand corner of the screen. The image on the right displays the elevated follicular unit after the dull dissection punch has retracted from the scalp. To maximize efficiency during harvesting, the system automatically tracks patient movement during harvesting. When a grid is completed, the system will retract from the patient and move to a saline flush station. This station will flush the suction system. In the following 90-second segment of uninterrupted video, we're going to demonstrate all of the steps needed to move the ARTIS skin tensioner from one grid to the next. The ARTIS system, the ARTIS system chair, the skin tensioner, and the skin tensioner tool are all designed to minimize the amount of downtime in between grids.
No, it's fine. You can't light it from underneath. See what happens when the robot moves it.
The procedure for starting the second grid is identical to that of the first. After installing the skin tensioner, we'll move the system to the center position, then select the relative position of the grid on the scalp. Next, we'll position the system at the center of the skin tensioner acquire the skin tensioner, now we're going to select the first hair to be harvested in this second grid. The ARTIS skin tensioner offers exceptional flexibility in that if the patient needs to adjust their head or body slightly, they can do so without moving the robot away or reacquiring the skin tensioner. With the system ready to go and the patient comfortable, we're ready to begin harvesting. During harvesting, the system indicates previously harvested follicular units with a teal-colored circle. The currently selected follicular unit is indicated with a green circle, and a purple circle indicates the next follicular unit to be harvested. At any time during the harvesting process, a hair selected with a green circle can be skipped or the whole process of harvesting can be canceled. The user is in complete control of the process at all times. The artist pendant allows the workflow we've just described to be controlled at the patient's side. During harvesting, the artist pendant can be used to control harvesting parameters, including puncture depth, coring depth, and the angle limit. With harvesting completed, it's time to remove the follicular units from the scalp. The two-forcep hand-over-hand method of follicular unit extraction offers the benefit of minimizing the damage to follicular units during the extraction process. In preparation for implantation, follicular units that are removed from the patient's scalp are stored in cold saline. And that concludes this artist system case example. Thank you for watching. Artists, Hair Restoration Redefined.